to know as Arkansas hits another milestone in the COVID-19 pandemic. First, a single day record of new cases. The state added 4,978 cases in just 24 hours. That puts the state at nearly 19,000 total active cases. Today, we also learned Omicron is now the lead variant in Arkansas. Now let's take a look at our area. In the top left corner of your screen, you can see Benton and Washington counties, two of the highest in the state for active cases. You can see in the map there in dark blue, that indicates 500 to 5,000 active cases per county. And according to the Arkansas Department of Health, right now, Benton County has just more than 1,100 active cases. In Washington County, just more than 1,000. Sebastian County has 416 active cases, and Crawford County has 195.
Since we're now at the level we were at the previous peak, and we expect to see that double by next week.
As COVID-19 continues to spread, the state is looking at ways to expand testing, slow down hospitalizations, and prep for an extended surge of infections. 5 News reporter Micah Wilson joins us live in Fayetteville with the state's response. Micah?
Erica, Omicron is now the dominant variant in the state after arriving less than 2 weeks ago and is actively rapidly making cases increase. And this comes just as many are returning back from work to work in school ahead of holiday travel.
Clearly, the demand has increased because of Omicron, because of the risk that's out there, and the rapid rise in cases as well.
Governor Asa Hutchinson spoke about the demand for COVID-19 testing. For the past week, Arkansans have been lining up at COVID testing sites before and after holiday travel. Many tests are coming back positive, with less than half of the state fully vaccinated, let alone boosted.
I'm puzzled by the fact that with the emerging Omicron variant as to why that has not gone up more.
Despite low vaccination numbers, Hutchinson is looking to make COVID-19 testing supply meet the demand.
1.5 million rapid home tests to be made available for free to Arkansans.
In total, the test will cost $10 million, paid for by the existing COVID-19 response budget within the Department of Health. 10 National Guards members will distribute them across the state.
It will relieve some of the burden on our healthcare workers, as well as help address the rapid spread of Omicron.
The tests are not here yet, but the state has identified a supplier. State leaders are also giving clarity on monoclonal treatments, saying one is more effective in treating Omicron.
For therapeutics to be effective, we really want to recommend that the sotrovimab be used.
He says it treats both Delta and Omicron cases, but the state is in low supply and is hoping to get more. And with the rise of cases coming in just before the start of the second semester, Governor Hutchinson says schools are prepared.
We are committed in Arkansas to in-classroom instruction. No, we're not stopping it. We're not changing course.
And 2 more points that I want to make and mention is that with at-home testing, you can get them from your local library as well as local health units once they are distributed, as well as right now we don't know how many we will see in our area. And then secondly, with the monoclonal antibody treatments, right now we know that we're in low supply, but the governor says is because of the federal government, they're the ones who control and allocate where they go. We're live in Fayetteville, covering news where you live. Mike Wilson, 5 News.
All right, Micah, thanks. And while demand for tests is high and they're hard to find, if you happen to purchase an at-home test at your local store or online, the Arkansas Department of Health is reminding people to self-report your positive test to its office. If you have a positive at-home test, you're asked to call the ADH COVID-19 call center at the number on your screen. That's 1-800-803-7847.